Bismillahirrahmanirrahim. In this video, we are going to discuss the vitals in traumatic brain injury and the Cushing's reflex. In case of traumatic brain injury, if there is an intracranial bleed, then it leads to a reflex mechanism which is called the Cushing's reflex, and it leads to a decrease in heart rate and increase in the systolic blood pressure. If there is an accompanied irregular respiration as well, then this triad is called the Cushing's triad and it is a deadly triad. And patient just has few minutes to live if you do not do any intervention. Now let's discuss how the Cushing reflex occurs. So brain is enclosed in a closed compartment which is the skull. This is a rigid compartment and does not expand. This compartment is lined by membranes which are called the meninges, in which there is a fluid which is the CSF, and in it is a brain which is a soft tissue. Now the CSF is present between the arachnoid mater and the pia mater, and it has a pressure which is called the intracranial pressure. Now what happens is that arteries they enter into the brain to deliver oxygen, and they have a pressure which is called the mean arterial pressure. Now when they enter this rigid compartment, the net pressure becomes the difference between this mean arterial pressure and the intracranial pressure, and it is called the cerebral perfusion pressure. So the cerebral perfusion pressure is the difference between the mean arterial pressure, which is 90 to 110 millimeter mercury, and the intracranial pressure, which is 5 to 15 millimeter mercury, and thus it is normally 75 to 105 millimeter mercury. Now, in case of intracranial bleed or any space occupying lesion in the brain like a tumor, there is a rise in the intracranial pressure. Due to this rise, the net cerebral perfusion pressure decreases and the brain no longer receives enough oxygen, causing the ischemia of the brain. Now, brain is the most vital organ of the body and ischemia is deadly, so the brain tries to compensate. What the brain cannot do is to decrease this pressure. But what the brain can do is try to increase this pressure, which is the mean arterial pressure. And if this pressure increases, the cerebral perfusion pressure improves and ischemia decreases. So how this brain does this is the Cushing reflex. So what happens is that in case of ischemia, the sympathetic nervous system gets stimulated and it leads to an increase in systolic BP and heart rate. This systolic BP leads to an increase in the mean arterial pressure, causing improvement in the cerebral perfusion pressure and decreases ischemia. Additionally, this systolic BP, it also stimulates the carotid and aortic baroreceptors, which further stimulate the parasympathetic nervous system. And that stimulation leads to a decrease in heart rate. So overall, the net result is increase in systolic blood pressure and a decrease in heart rate. Now, this is a limited mechanism, and then the patient has the need of some surgical intervention to reduce this intracranial pressure. Otherwise, if the pressure continues to increase, then they will lead to a herniation of this brain from the brainstem, causing irregular respiration, which is called the chain stroke breathing. And when irregular respiration also starts, then this triad is called the Cushing's triad, and it is a deadly triad. So now when the patient is in the ER in front of you, you cannot remember the whole mechanism to tell whether the BP will rise or fall. You have to remember the tips. So the intracranial bleed, it occurs in the brain, while the neurogenic shock is in the neck region due to the cervical spine injury, and hypovolemic shock is due to the abdominal thoracic injury. So hypovolemia, you all know that it leads to hypotension and tachycardia. So there's a decrease in BP and an increase in heart rate in case of hypovolemic shock. Now the opposite of this is this neuro intracranial bleed, the uppermost one. So it is the opposite and it leads to increase in BP and decrease in heart rate. And in between these two is the neurogenic shock, which leads to a failure of both mechanisms. Thus, there is a decrease in heart rate and there is a decrease in BP. So this is it. I hope you all found it helpful. Thank you.